Hello, everyone. Thank you so much for joining us. I'm absolutely thrilled to have Kristy Stiles here with us this evening. Kristy is a burns and plastic surgery specialist nurse with an MSc in burns care. Chris is passionate about educating people about burns first aid and about out of hospital care for burns injuries, because that can make a huge difference, as she'll tell you, to the long-term outcome for the casualty. As with all of our webinars, Chrissy will talk for 20 to 30 minutes, and then we'll open the floor to any questions that you may have. So without further ado, Chrissy, over to you.
Thank you very much. Welcome, everybody. As Tina said, I'm Chrissy. I'm incredibly grateful for you all to joining us on a Monday evening, when I'm sure you'd rather be doing lots of other things, to hear about burns and the importance of first aid. I'm going to try and cover as much of the importance of the initial care as I can. And some of my slides will have images of burns in children. So preceding that slide, there'll be that exclamation mark sign to warn you that there is a graphic image coming up, just in case you find it distressing. And I'm quite happy for you to turn away and then join as and when you feel comfortable. So without further ado, let's cover what burns are. When we're talking about burn care, one of the key elements to understand is what is a burn. And a burn injury can be all manner of things. And the mechanism that the burn injury can injure our skin is manifold. And as you can see on the screen, there are actually 1, 2, 3, 4, 5, 6, 7, 8. There's 8 different ways that we can get burned. So it can be through a flame. That's whether that's an open flame, you are close to a flame, or a flash flame that kind of touches your skin briefly. It can be as a hot liquid scald. It can be contact with hot surfaces. It can be through radiation, so sunlight or other kind of rays, gamma rays. Chemical injuries, and that's acids or alkalis, so different types of chemicals injure in slightly different ways. Electrical injuries, that can be either in a household or in an industrial setting. Frostbite, so it's a burn but with a cold substance, and friction burn. All of these present across our national burn services. Some of them are more rare, but some of them are more frequent. And it might not surprise you that majority of the patients that we see in the national burn services, actually, when we talk about adults, they present mainly with a flame injury or a scald burn. When we're talking about children, most of them will present with a scald burn injury or a contact burn. When we talk about elderly, again, it's a scald and a contact burn mechanism. The rest are much, much rarer, but you still would need to know how to do the initial management of all of these, simply because some of them have a very dedicated treatment pathway. So the specific things that you would do for each type of burn. But it's really difficult to describe what is the one thing, one treatment, one initial care that you would do for a burn, because a burn is 8 different mechanisms. So I will tell you today, mainly we'll concentrate about pediatric burns. So what happens to children when they sustain a burn injury, and what do we do? To understand burns in children, I had to look back over our statistics, national statistics for the last year. So last year, just over 9,000 children presented to the specialist burn services across the UK. Now, these are numbers that only show the children that had severe enough burns to end up in a specialist burn service. And that's not counting the hundreds of thousands of children that actually attend local GP practices, go to minor injury units, or emergency departments all across the country. When you look at the breakdown by age, it actually becomes very clear that majority of the children that we see are under 5 years old. especially worrying is the fact that you've got babies to 2-year-old age group that are predominant in that with a burn injury. And these are your newly mobile toddlers. These are babies and very young children who are exploring the world with touch, with their mouths, putting everything in their mouth and trying to reach for things that grown-ups have around them. When we're trying to find out where and how burn injuries happen, this is what our national statistics tell us. The injury happens usually from hot liquids, either hot liquid that's been cooked, so noodles, soups, things in bowls, things in saucers, or teacups. So teas and coffees are quite prevalent, or contact with electric hobs or things like hair straighteners. Those present over and over again to the burn services. The reason why it happens is because children are playing or exploring their environment, or parents are cooking and child happens to wander into that area and grabs the hot food or grabs the arm of the saucepan with the liquid and the contents coming down on top of them. The areas you can see in the household, burns happen really, really close to home. So it's everywhere we are, where the grown-ups are, we're meant to be supervising these little ones, but they wander in under our feet where we're doing activity that's unsafe for the child, and the children are more likely to get injured. So the most dangerous room in the house is the kitchen. Then second is the living room. And as you can see, you've got also bathrooms, a bedroom and the garden. So, but predominantly it tends to happen in the kitchen area. So just something to note. So what happens first? The key messages throughout this talk today I want to get across to you is that children's skin is slightly different to an adult's. It's different because it's much, much thinner. As we grow up, so a baby's skin is very thin, very fine. And as we grow, that skin thickens up towards age. As we get older, so as we go into older age, being over 60, our skin thins again. So it's more likely to tear and more likely to get injured. So very young children are actually more prone to get a more severe and deeper injury that then might require an operation just because their skin is so thin. So the cup of tea that you might be drinking, if you spill it into your lap, you might get pain, you might get a little bit of redness on your skin, but you're less likely to get blistering, you're less likely to get really deep burn. That same cup of tea, if it falls onto a child, they're likely to get blistering, they're likely to get a severe deep burn that might end up in a scar. We know that burns hurt terribly. So one of the key things that is the managing of the distress and the pain of the person that's been injured with a burn. And children will display their distress, scream, they will get really traumatized, they're distressed, and they take it out on you, and it's loud, and it is impossible to try and think straight in that environment. So be aware that this is what is going to happen, anticipate that this is what could happen. Skin will bubble, so blisters will form. Sometimes they're flat, collapsed blisters, sometimes they're blisters that are fluid filled, and sometimes they will rupture. And that is okay. That is just what happens as part of the burn injury process. So it's not anything that you're doing necessarily, but it can happen. Burns can be superficial, so not so serious if it's just redness, but there can be really, really serious. And in children, any burn that's bigger than a 50p piece size is actually considered a serious enough burn for you to seek medical attention. Burns don't just get red and then subside. Like if you ever been sunburned, you know what that is. It tends to go away after a couple of days. In children, burns can be much more serious than that. They might require an operation, and once they heal, even once they've had an operation, they can heal into a scar that never goes away. Burns will be incredibly emotional for everybody involved, for the child, for the parents, for the responders. If you ever get paramedics into your environments that come in, everybody will be distressed by what they're seeing and what they're having to support. So just take a little bit of time and be compassionate with yourself that this is going to be a stressful time, but you need to try and get your head straight with the advice that I'm going to give you, the things that we must do to make sure that we do the right thing to avoid the operation, to avoid the scarring for that child. Because the best first aider is the person that's already there, and that is usually you. If the burn injuries just happened, don't wait for someone else to come up with the solutions. You are already there. You've witnessed it, or you've just arrived. You are the best person to do the right thing. This is what burns look like. So I deliberately thought I would show you the ones that we see the most. So on the top right, you see a child's foot with a big blister. This is what I mean when I say the blisters will form. This child walked across a ceramic hob that was on. He was sat at the side of the oven, at the side of the hob by a parent. The hot plate was still on, and the child stood up and wandered over and sustained a burn injury. The bottom right is a child that pulled down a hot drink over herself and affected her neck and her chest. And you see some blisters that have popped on her chest there. Then the bottom left is a child that was left with a dummy in their mouth, sleeping in the sun and got sunburnt. And then the top left is actually a friction burn from a treadmill. These are really severe injuries, very deep. You can see that the white discoloration on that child's fingers is actually very, very deep injury that definitely requires to be seen by a specialist. So all of these are the types of burns that are more likely to happen around a household and more likely to be seen in the burn service. What's important to know is that the skin has a few layers, and the most important layer is the middle layer. So I don't so much want to puzzle you with lots of anatomy and physiology, but I want you to see that the very top layer, the epidermis, is actually the bit that we know as grown-ups. So we'll know this very well, because if you've ever been sunburned, it's the bit that you can peel off over a couple of days. If you're a picker, you can peel it off and then it heals without scarring. So epidermis has a capacity to rebuild itself without building scars. The dermis is the next layer down, and look how busy dermis is. Inside of this layer, you have all the really important structures that make our skin behave like skin. So you have really important tiny, tiny blood vessels. You have all of the nerve endings that make us feel pain, pressure, hot and cold. All of this is inside that. So you have the pressure sensors, you have the nerve endings, you also have the sweat glands and the oil glands. You have the hair follicles that are sitting there as well. It's important to know this because if the burn injury goes as deep as the dermis and as deep as the bottom layer of the dermis, those structures will not regenerate. They will not regrow. So if you have a child that spilled a hot drink over their head where the hair grows, and if it's gone deep through the dermal layer, actually the hair will not regrow once the wound heals. It's a really important moment to understand that your first intervention, your key first aid interventions for any burn in the child is absolutely key to try and reverse this damage that otherwise will happen. And obviously, if it's gone down through the third layer, that subcutaneous layer, that could be fat, that could be muscle, that could be bone. That's a really, really deep burn that definitely requires to be seen by a specialist. The reason why we talk about skin so much is because it does so much for us. Skin is actually the largest organ in our body. It acts as a protective barrier, as a shield to us, barrier from infection. If you ever had a wound, you know that it tends to leak and ooze quite a bit. So it protects us. So it prevents any loss of moisture from inside of our body. It's a sensory organ, so it helps us feel our environment. It helps us regulate temperature. If we're hot, so, we sweat and pores open up. If we're cold, they close up and we shiver. It also helps us reduce the harmful effects of UV light. It helps us produce vitamin D, which is essential for bones and muscle. And obviously, it's such a massive part of our body image. If you're burnt and you've healed with a scar, all of a sudden, all of the functions of your skin have been altered and affected and possibly damaged beyond repair. And none of these things will work anymore or might be faulty in the way that it works. I want to show you this graph. Don't worry too much about the very complex terminology. Just look at this block of 3 layers. So the 3 layers signify the 3 layers of skin that I just talked to you about. And when the burn injury happens, those 3 circles occur. We might only be able to see the top down, so what happens at the top of the skin. But all of these circles are 3-dimensional, so the damage happens deep inside the tissues. The very central circle, the black one, is the damage beyond repair. It's the bit where, say, the cup of tea fell first. We cannot change the outcome of that area because that's the one that had the longest contact with the hot substance. Then the circle, that's the orange circle around that, is the static zone. It's the area of the damage that we can totally reverse. This is the one where there'll be static blood flow. So the blood vessels kind of stop flowing for a moment. They're not quite sure what exactly to do about it. They know that an injury has occurred. If we do appropriate first aid, if we give pain relief to relieve the stress on the body that's feeling this agony of the burn injury. In a big burn, we give them fluids through the vein, and that's fantastic. That again encourages the blood flow, and putting on a dressing that won't traumatize the wound. All of these 4 factors can help reverse the damage within that orange zone. And remember, it's a 3-dimensional zone, so it goes all the way deep into the tissues. And then the red circle is, we'll call it erythema, but basically it's the redness, it's the swelling, it's the bit where you are likely to feel the most pain. So everything, if you've got your skin injured, it's going to start swelling, it's going to give you pain signals, and that's the bit that hurts the most. So you're trying to prevent that black circle from expanding and encroaching into the orange circle and into the red circle by doing the appropriate first aid interventions. This is probably the best way I can show you what exactly happens at the skin level. So the egg is in the hot pan. The pan is standing on a hot hob. If the heat is on underneath that pan, the egg will continue to cook. So you can see as we step through frame by frame, the white of the egg starts to congeal, become more solid until the egg is finally cooked towards the end. This is exactly the same thing that happens as the burn injuries hit the skin. So you've got heat in the tissues, you've got the heat in your skin if you've burnt yourself. All the time that the heat is on, that process is going to keep happening. You can take the pan off the fire, but the pan is still hot. And that's the same thing that happens. You can remove, if I'm no longer on fire or I'm no longer pouring the hot drink over my skin, the heat is now in my skin, continuing to cause this process to occur. The only way that we can stop this is by putting appropriate first aid. Burns are dynamic wounds. They change over time, and it all depends on what we do on day 1. So as the injury happens, we need to act appropriately, because if we don't do first aid by day 3, it's the same wound, but it's changed considerably, and it becomes really, really deep, and it will require surgery, and that will end up in a terrible scar that the person will have to live with for the rest of their lives. And it takes 3 days. Whether you do the right thing or you haven't done the right thing, it takes 3 days for the burn injury to decide how good or how bad it's going to be. So that's why usually in the burn service, we decide whether the patient will require surgery on day 3. First step is always to remove any clothing, any nappies, if it's a young child, or any jewelry that's anywhere near a burn. If you ever had a soft tissue injury, like a sprain, any kind of a sporting injury, you know that your skin and anything around your injury will start to swell up. And the same thing happens with the burn injury. So you're worried about the swelling. So anything that can constrict, so things like rings and bracelets and necklaces or earrings, you remove everything that's near that burn, just because the skin is going to swell around it, and potentially that will affect how the blood can or possibly can't flow through those tissues. The other thing that we'll remove is clothing. So if the clothing has had, say, a hot drink spilt on it, it retains the heat against the skin. It actually makes the burn worse. And the idea of removal is that you take the bit that keeps the heat in away. So take the clothing off and away. Expect burn blisters. One of the things that also expect is that if you are removing clothing of a young child, the blisters will form very, very quickly. And potentially when you're removing the clothing, the blisters will rupture. So they will burst and start leaking. The blisters themselves have no feeling whatsoever. The bit that has sensation is the wound. So the bit that then is exposed to air is the wound itself, and that's when the nerves start to complain. That's when the patient, the child, might feel a little bit more stinging, a little bit more pain. But the pain is not in a response to blisters tearing. The pain is in exposure of the wound to air. So quite often parents and care providers are scared about removing clothing because they can see the blisters rupturing, the skin literally coming off the child. But actually, it's not you removing the clothing. It is just a natural process of the burn injury. And especially when you start applying first aid interventions, expect the blisters to rupture. Just because the child's skin is so thin, it will happen. It is a normal process of the burn injury. Certainly not removing clothing or being mindful or being scared about doing first aid for fear of blisters rupturing is not good enough reason to not do it. So remove clothing and definitely continue with first aid. Now, one of the things that we always come across is all of these kind of old wives' tales and domestic remedies for how to apply first aid. None of what you see on your screen is first aid. The amount of children that we have presenting to the burn services that have toothpaste applied, turmeric applied, butter, oils, different creams, bags of frozen peas, bags of ice, none of this is first aid. In fact, actually, a lot of it will mask the burn injury. So when they come to the first medical provider, it makes it incredibly difficult to assess how deep the burn injury is, how the size of the burn injury. So actually, don't put anything like this on. So no creams are required, no topical treatments. And do you remember we talked about the dermis having those tiny little blood vessels that are struggling when a burn injury happens? They're not quite sure exactly what to do. If you stick anything really, really cold on top of it, like ice or bag of frozen peas, it actually shuts down the blood vessels. It makes them withdraw. It makes them come away from the skin surface, which means that the skin is not getting the oxygen or the nutrients that it needs to live, to survive. And if it doesn't have oxygen, it's going to start to die. So it's going to deepen and progress. And that burn that we started off that potentially was small, because of the inappropriate first aid interventions, is now going to be bigger and deeper and now require surgery and end up in a scar. Anything greasy or sticky like creams or butter with actually coats the burn injury with a shield of kind of that's impenetrable. So as the heat is trying to escape from the skin, any grease will actually keep the heat in. So putting creams or butter or anything like that on is not advocated. So none of this is first aid. So what is? So best case scenario is that you're very close to a tap or you're very close to a shower or a bath. So the British Burn Association is advocating cool running water. It can be lukewarm or even warmer, but it needs to be applied for at least 20 minutes, and it needs to be done within 3 hours of the burn injury. So the only time that first aid is actually effective for a burn is for 3 hours from the time that the burn injury has happened. So key things to take away from this slide is that water is best. You don't need to apply cold water. In fact, the warmer it is, the better. So the warmth is dependent on how much your patient, the child or the person that's injured with a burn will tolerate it. And quite often, if it's a child that can speak to you, they'll be able to say, yes, this is okay. If it's a tiny one, just judge it by your arm. It does not need to be cold. Anything temperature from 15 degrees up to body temperature warm is still considered effective first aid. So it can literally be lukewarm or even warmer to affect that change for the better in the burn injury. And the other thing to remember is the 3 hours. It's effective only for 3 hours. As soon as the burn happens, the clock is ticking. It's really important we don't miss the opportunity to intervene and change something, the outcome for that person. Say we're somewhere where we don't have copious amount of water. Okay, so then we can use wet, clean cloths or towels. So if you have a bottle of water, you have a clean scarf or a clean t-shirt or a clean cloth, we can use that. So we pour some water onto the cloth and apply it to the burn injury. The main thing to remember is that that cloth will very quickly warm up. They will warm up against the heat of the burn injury and stop being effective, stop being the coolant that we're after. For that reason, you need to replace that every 5 or so minutes. Keep applying a bit more cold water, keep reapplying the cloth back on. Some people choose to put the cloth on and just keep reapplying some water to the cloth just to add a little bit of that coolant on. It's nowhere near as effective as running water, constantly running water over the skin, but this is better than doing nothing. We still do a total block of at least 20 minutes, and this is still effective within 3 hours of burn injury. Remember that you need to cool the burn area only. You don't need to douse the whole child, the whole person in cool running water. So you can keep the rest of them wrapped up and warm, but expose the bit that needs to be cooled and just cool that. Keep the child as warm as possible. They get cold very, very quickly. So that will be also in combination. They're only not getting cold, but they also are distressed and they're in shock. So they will start to shiver and shake. And that's a natural process. So you need to watch out. Are they actually cold or are they just in pain and stressed? So either way, the best way to manage them is to try and get one of their providers or somebody that they trust, usually a parent if possible, to cuddle them and jump in the shower together with them. So in order for you to concentrate on delivering first aid, you get the parent to look after the child and you can then do the first aid, doing the showering for that child, or even ask the parent to do it. Child is more likely to allow their parent to do this than they are a stranger, especially a stranger in a uniform. So why do we bang on about first aid? Does it really make such a massive difference? And the answer is yes. We have studies over the last 20 odd years that showed that the benefit of cool running water means that the patients heal faster, their burns are less deep, less severe, they're less likely to need an operation, or the amount of area that they need to have operated on is less. They stay less time in hospitals. They're less likely to get an infection in their burn wound, and they're less likely to scar. And all of this from you being able to just do the 20 minutes cooling within that 3-hour window. So back to that block, just to show you how it actually works. So we start with the top block in the middle at the top. Without any first aid, the bottom right, you can see that that black area, the area that we couldn't change, the area that was so badly damaged, we can't actually reverse it. We didn't do first aid, we didn't do 20 minutes, or we didn't do it within 3 hours. Now that areas encroach into the orange block and a little bit into the red block, and actually you have a deep and big burn, much bigger, much deeper than it needed to be because of no first aid. With first aid, we've retained the bit that we couldn't change, but actually that static area where the blood vessels weren't quite sure, because we delivered the first aid, it actually now became that more superficial injury. Yes, it's still painful, but it's superficial enough that it should heal by itself without needing surgery and without resulting in scarring. It's fantastic. What more can you ask from a free resource that's usually so readily available to hand wherever we are, and most places where these burn injuries actually happen in our safest places, in our homes. You always have access to a tap. This is how burn injuries heal. So from day one, doing first aid on that blistered, collapsed blister burn, to day 3, this is when we would make a decision. Does it need a skin graft? Does it need an operation? Or can we just heal it with dressings? And because first aid was done, I can see that actually that burn injury can heal by itself with just dressings. And by day 10 and day 16, usually within 10 to 21 days, burn injuries should heal if they had appropriate first aid. So this is the process that you would hope the burn injury would follow if the right thing was done at the right time within that 3-hour time frame. This is what happens when first aid is not done. This little one here, she spilt a cup of tea over herself at home. So neck and chest was affected. Mum didn't do first aid. Mum thought, I'm just going to bring her to the A&E department. They will know what to do. An A&E department saw a child that was awake, that was screaming. They gave some pain relief, but because there was no airway or breathing or circulation issues, the child was made to wait. They waited in the waiting room, and the 3 hours ticked away until it passed. And by that point, it was too late to do first aid. It would not be effective after 3 hours. It means that by day 3, that same burn injury that actually was superficial enough that it could have healed by itself, you can see the change from pink to opaque white. You want the wound to be pink or red, bleeding. It shows you signs that the blood vessels are intact, that they're working, that there's a blood supply to the wound. If the wound has gone opaque or white or yellow or brown or black, there is no blood supply there. This is a really deep burn that now will require surgery. The surgery will always end up in a scar. The surgery usually means taking skin from somewhere else on the child's body to replace the bit that's missing. So now the child will end up with 2 scars, one where we borrowed the skin from and one where they burnt themselves. This injury for this child will also have consequences because this is a girl. When girls grow, the scars, it's not just girls, actually, children grow and their scars contract. But for girls specifically, it poses an issue when they hit puberty and their breasts start to try to develop. For a child that has a chest burn, that scar potentially could prevent the breast tissue from developing. So that girl might struggle to grow her breasts and will have to come back to the burns unit to have operation to release her scars in order so she could grow with her body. Those are the consequences of those very, very early moments, those early decisions. So when you're unsure or kind of trying to persuade yourself, is it a good idea? The child seems too distressed. 20 minutes, such a long time. Yes, it's a lifetime. Yes, they're going to be screaming their head off. And yes, you're going to be absolutely petrified and distressed during it. But nobody wants the outcome like this for a child. If this was your child, what kind of outcome would you want? That's why it's so important to do the 20 minutes cooling within that 3 hours. This is what a healed burn looks like. This is what scars look like. And scars are actually a natural progression of wound healing. If we have wounding, scarring is actually the way that our bodies have learned to adapt to heal themselves. So scar is what we'd expect. It's great. The body has healed. But as society, we shun people with scars. We stare at them, we point at them, we don't accept them in the same way. And unfortunately, that is the reality for so many children and so many adults who are living now as adults that got burnt as children way back then. These people will continue living for decades with scars like this. They are tight, they're itchy, they crack open, they don't stretch, they're not pliable, and they're really, really challenging to live with and require management for the rest of that person's life. If we can prevent this outcome by doing 20 minutes cooling within 3-hour window, why wouldn't we do that? We know that when studies are done about why first aid isn't done, we have picked up that actually patients who don't get first aid tend to be that very challenging under 2-year-old group that we find so distressing to look after. So under 2 years, the young toddlers don't get first aid. The 15 to 16 years, I'll leave you to make your own conclusion why we don't give first aid to them. Patients who live rurally or in a very remote location tend to not get first aid. Patients who come from low socioeconomic status and patients with flame burns, I think simply because they tend to be bigger and deeper and might have other priorities in care. When we studied the medical providers, so this is professionals, and we're asked, okay, so what are the barriers to you giving first aid to that patient? Why didn't you? They quoted things like the patient was too distressed because of pain. There were other medical priorities, so maybe airway or breathing. We needed to rush the patient away from the source of water. Too much emotional distress. So that keeps coming up. Emotional distress. The patient was distressed. Their caregivers were distressed. So we couldn't stop and do that. dressing issues, so not having appropriate dressings or not appropriate kit, not having sufficient knowledge and training to know that it's important to stay and do the 20 minutes calling. The behavior of the patient or the caregiver behavior, quite often getting aggressive or agitated around the responders wanting to do first aid, but actually being persuaded that we should be going to the hospital. Why are you just splashing water on them? So not being strong enough to know, actually, this is key essential treatment that I have to give right now, otherwise the time is lost. Difficulties with communication, again, with the patients or caregivers, lack of water resources, and time pressures, the wanting to turn the ambulance around quickly. Surely, if we just get them to hospital, the hospital will do the right thing. All of these were reasons for not giving first aid. When we asked, well, okay, but what made you do first aid? So we flipped the question and say, okay, those ones that did do first aid, why did you do it? Like, what made it happen for you? Giving rapid pain relief was key. You give pain relief to the patient, you take the pain away, you take the sting away. And remember, first aid will do that too. If you're cooling the burn that's hot and angry and painful, actually you're already giving pain relief to that child. So giving pain relief is absolutely key in calming down the emotion and the stress of the situation. Having good access to equipment and appropriate resources. You had patient and caregiver cooperation, communication, being able to advise and guide the parents on how to help the child that's distressed and upset, having all of the protective dressings, having your own confidence that you have the knowledge that this is key, this is so important to do right now, otherwise I won't be able to repeat this and no one else can do this apart from me right now. Having clear clinical guidelines that this is what you have to do right now, that's the key intervention. Having access to more superior, more advanced knowledge. So you could phone a friend and say, right, this is what happened, and having guidance. Having a stable, secure patient. So a patient who's not distressed, but also patients who's not deteriorating. So you can stay and you can do that first aid. And also having an incident location that was close enough to the hospital where you were going to go and you weren't too rural. Seemingly that medical providers were much happier to do first aid under those circumstances. So no one's perfect, as you can see. But the thing to remember is that in burns, timing is everything. Burns don't care who's there. If you're there first, you are totally the best first aider for that child, for that person with a burn. Because as you can see, the time ebbs away from all of us. You need to do at least 20 minutes of calling, and this is only effective for 3 hours from the time of burn. If we don't do this, the changes of the burn injury will continue to migrate the depth and size of the wound for the next 3 days, and they'll peak at 3 days, which is when we as burn providers can decide, does that need surgery or can that heal by itself? And if the burn injury doesn't heal within 3 weeks, so that 3-week window cutoff, if it doesn't heal within 3 weeks, it's more likely to end up with a scar. So timing is absolutely key. Once you've done your first aid, you cover the wound with loose cling film or a clean cloth. Make sure that you put on lots of loose strips. You don't wrap it tight and don't wrap all the way around. Literally, you just need to cover it. So, and whilst you're doing that, you're keeping the child as warm as possible. And once you've covered, after you finish doing first aid, you call for medical advice and you take the child to the medical team for review. So any burn that's larger than 50p coin, you need to call GP or 111. And obviously, if it's an emergency, you dial 999. It's so important that these children, however small the injury might seem, we know that there are certain areas like joints that have terrible consequences with scarring and tight banding that then influences their function and their movement for the rest of their life. So it might seem small to you, but it's just be good enough to just have it checked out. And one final thing is just to say that you make sure that you give pain relief. If you have permission as a caregiver to give the pain relief, you know, Calpol, ibuprofen, these work so well for children. So don't be shy about giving something. They're in pain. What would you give for a headache? What would you give for tooth pain? This is what we would give. So absolutely is the right thing to do to give the pain relief that you have. If you've called for an ambulance, they will turn up and give a more advanced pain relief. But you start with the basics that you have. Give something to take that edge off because the burns are going to hurt like hell. What you do makes a difference, and you have to decide what kind of difference you want to make. Thank you very much. I'm open to questions.
Thank you, Chrissy, and evening, everybody. For anyone that doesn't know me, I'm Amy, and I do quite a few of these talks. My background is as a children's A&E nurse, so obviously I've seen lots of things like that. So thank you, Alan, for already starting the chat. So anyone that wants to add in any questions for Chrissy, we've still got a good 10, 11 minutes. So pop them into the Q&A. But I will start with the questions that we've got. So we've got one that we had in advance, and we've got this one now. So if you've got no water at hand, so completely understanding that cool liquid is what we should do, and running water is what we should do. But if we had absolutely nothing, I'm guessing we're out in the countryside. The question was that, having heard before that any cool liquid would help, even something like a dirty river, or a river source. What is that correct? And what would your advice be there?
So a massive concern with all burn injuries is infection. Of course it is. It's an open wound, and there is a massive risk. As soon as the skin pops open, any bacteria can migrate in. So we're always worried about that. But the reality is, quite often, if you're on fire, for example, this fire service tell you stop, drop, roll. We're not rolling in sterile soil, so we're quite likely to contaminate our wounds. Patients quite often, if they are near a body of water, whether it's a sea or a lake or river, they will run into that and put themselves out. If they're on fire, or if something is stinging or burning, they will go to that and put that water on. I think that is a fair assumption that that is okay to do. But what we would like, if possible, is that you take the container of that water and bring it with that person to us. So we can send it to our lab, we can test what bacteria is in it, and we can treat the bugs appropriately. So we know, we're kind of pre-warned as to what infections are likely to raise their ugly head. Ideally, obviously you have 3 hours. So if you can get them to water, any domestic properties over the hill there somewhere, knock on the door and ask for that. But in complete absence of water, and you have a river source or whatever, yes, okay, use it, but bring the sample with you if you can.
That's a great tip. I would never have thought of the sample, so thank you. Next question. Are there any differences? Sorry, I'm looking at my other screen. I'll move it across. Are there any differences with regard to removing clothing for flame burns, or just any general differences for flame burns, but particularly the query was like removing clothing?
So the issue here is more likely to be molten clothing. So things that melt and then attach themselves to skin. So that can happen. So the advice is usually, you cut away if you can, anything that comes off and is loose. If you've given it a good tug and it's not coming off, you leave it. Okay. So you cut away the bit that's stuck, you leave that there, but everything else remove. Because either way, somebody with a flame burn will be going to surgery straight away. So as soon as they get to the burns unit, we'll take them in. So anything that is loose, remove. The other thing that I would like to address here, if somebody's not got a flame injury but has a chemical injury, so if they have chemical on their clothing, one of the things to be very mindful of when you're helping them remove it is that you're very likely to get contaminated yourself. So usually we ask that you talk the person through removal of clothing themselves. Ideally, they don't remove it over the top of their heads. The tendency is always, how you undress and go over your head. Don't do that with chemicals, because if the face is not affected, you're about to get it completely covered in the stuff that you don't want anywhere near a face. So usually if you have scissors that you can cut away clothing, you cut at the back and take it off like a shroud off the front of the person. So get them to actually just dump it off themselves. So very, very mindful about what you're about to help with, and if you're likely to get injured yourself. So some things might still be hot, or there might still be a chemical that you could actually get on yourself, and then there's 2 casualties. So be very careful of that.
Lovely, thank you. We've got quite a few now coming in. So burns inside the mouth, difficult to treat. So have you got any top tips for that?
Oh, I've been asked that a while ago. So yes, they are very, very difficult to treat. If you have a compliant and age-appropriate child, usually we ask cold water in, swill, spit out, swill, spit out. So just you keep going through irrigation, obviously not swallowing, otherwise like the 20 minutes of that is going to be a lot. So probably that's more appropriate. It's the only thing that you can realistically do. And one of the things that just I remembered about your very, very first question about any liquid suitable. So I'm just going to go back to that. I know that actually not so long ago, British Red Cross posted that you could use milk on a burn. That's what a lot of questions will come in. Well, can you use Coke? Can you use beer? Can you use milk?
Remember that.
Yeah. The concern is actually, it's not so much the liquid that you're using per se, that you need 20 minutes of it. If you have 20 minutes of beer, like my colleague said, why waste good beer? You might as well just have it for analgesia for yourself. But that's not the point. You don't have sufficient amounts to pour. Yes, you can take the sting out, but then what? So you still are actually, the best thing is to go and find water. If you can get the person to water within 3 hours, and I quite often relate to next door property. If your house is burnt, you always have the neighbors who still have a working bathroom. Knock on the door, bust your way in. You need that 20 minutes, or fire service. They can make water happen as well. So actually there's always solutions if we think about it.
Brilliant. Okay. We knew this question was going to come. So burn gels, good idea or not good idea? So thank you whoever asked that, because we debated that before the call.
Yeah. So the answer is there is no evidence to support their use. There is no evidence to support that they're effective at reversing the burn damage that I was talking about. So that progression of the burn, size and depth, there's very, very weak evidence to say that they're in any way effective for that. So the studies that we have say they're very good at pain relief. And the reason why they're good in pain relief is because they're wet, that you put on and you cover the nerve endings. So that takes the sting out when the wound is exposed to air. So the patient is feeling wonderful. So they will say, this is really effective. But at the skin level, those changes that are so essential to reverse that damage from progressing are not happening. So ideally, and like I showed, most of the burn injuries often happen where there is water. So if you have a burn gel in your first aid kit, and where I work, we have a first aid kit and there is a burn gel in it, but it's in the kitchen, literally next door to a tap. And I would put a sticker on, say, reach for the tap first before you think about the gel. What is good is, because we know that it works for pain relief for patients, actually, after you've done your 20 minutes, you could put it on for the transfer of the patient to go to the hospital or wherever, because it's still going to keep having that pain relief property for that person. Also remember that nothing works as good for pain as actual pain relief. So give them pain relief. Don't just rely on first aid or gel dressings.
Thanks for backing me up on that one. The last two webinars I finished with, please give children pain relief. So nice to have it twice. So next question, and I think we're nearly there, but next question, why should you not apply the ice directly to the burn?
So ice has, if you ever been cold, your fingers go blue and purple. And the reason for that is because blood vessels constrict and withdraw from that area. So actually there is very minimum blood supply to that area. If you apply ice onto the burn, the same thing happens. The blood vessels constrict and withdraw. So you don't get oxygen, you don't get nutrients, and the skin dies. And if the skin dies, you end up with a deep burn that then requires surgery and will end up in a scar. So no ice. We know that in lab experiments, ice works, so icy water 2 degrees upwards works for reversing the damage in the burn. But you have to have a person who's willing to tolerate 20 minutes of that coolant on their body. And for children and elderly specifically, they're so prone to hypothermia. You're going to kill them first before you actually affect that burn. So prioritizing, what am I trying to achieve here? I need to reverse the damage of the burn. I can do that most effectively with a lukewarm or slightly warm water running over the person's burn for 20 minutes at least. Ice is a no-no, absolutely categorically no ice directly on the burn. Not only does it constrict the vessels, it can also cause a frostbite injury. where literally you're actually burning the tissues with the cold ice and progressing that burn and giving them a deep burn. So yeah, no ice.
No ice, definitely no ice.
Yes.
We've got someone that just literally probably typed this literally as you were giving the example, which was just really yet all those burn gels are sold. Despite what you've said. And then we just had another query, which I think Tina has probably answered, which was just about whether the webinar was available. So yes, in the same sort of way as normal. And if you go through to Safe and Sound, they'll be able to give you the link. But we will make the video available. But one of the things we need to just explain to everyone is that this time when the webinar is released, a lot of the photos and the stories will have to be removed because we need to protect, obviously, all the photos and the children that Chrissy has used have consented for it to do it in this format, but we need to safely know where those pictures are going. So they will be removed. So just for information, but the first aid and her advice will all be there for everyone. So I think we've probably, to be fair, here comes Tina. There we go. Come on in, Tina.
I
I
was
was
going to
just going to
say,
wrap it up.
that was absolutely fantastic, Chrissy. And I'm glad that Amy came on to do the questions because I was welling up. I couldn't have done it at that point because it just, we teach first aid and safe and sound. We teach first aid to thousands of people looking after children every year and 20 minutes cool. But and we know that it's really important that's really important, but hearing it from you, working with your patients, just reinforces it so strongly about how, yeah, it is a long time. Because when you burn your finger on the oven and you do it 2 seconds under the
Oh,
cold water, but seeing the difference, it was just absolutely incredible. And I think that for any of our instructors watching this, we will pass that message on so much more forcefully.
And I think the 3 hour message, I mean, you had all the
The
threes.
3 hour,
I mean,
absolutely.
the 3 days is interesting to me as someone who sends them to you and then doesn't see what happens to them afterwards. But the 3 hours, actually knowing that,
Yeah.
um, I absolutely knew that there was a time scale, but to really remind people that actually, as you said, if you're 10 minutes away from home and you can put a bottle of water in a cold flannel, then just drive back as quickly as possible and then sit for 20 minutes under cold water because you're still comfortably in that time. And that really reiterates actually what we do, which is, I'm obviously horrified by the two where you said A&E's just stuck them in the waiting room. We're going to move swiftly past that. But to know that when people come in 45 minutes after a burn, an hour after a burn, we often still sit them for 20 minutes then, and I think that message isn't as clear, so that's probably a good one. But
I would
I'm
also
also very
do
conscious of time. Yeah,
I
go
would
on.
also always do my own first aid. So if the parents bring the child to you and say, we've been under the shower for ages, like Tina said, it has never ages. It
I'm
has
going to
never been
interrupt you
20.
just for 1 second, just to give you a last thing. So, thank you to the brave person who's put on that says, I'm a burn survivor from over 40 years ago, and my dad did proper first aid at the time. If he hadn't, I would look very different.
Yes, absolutely.
Wonderful.
Love to your dad.
Yeah.
Yeah.
Absolutely the right
I
thing.
think actually that's just a very nice point to end on because you are
But hold
really
on,
braving
yes,
again.
it is a lovely point, but I want to push. Chrissy's got a fantastic book
Oh,
that she's
yes, you do.
written
Sorry.
for families, for children. And I think if
I
you're
don't know. I don't know if
if
it
you're
could
early
actually will come up.
Put it in front
childhood,
of your face.
let's have a look at that, please, because that's a wonderful thing to be able to buy for your children. It's for children,
It's
isn't
free.
it?
It's free.
It's
It's
free,
free.
even
You don't have to
better.
buy it. It's available from the Children's Burns Trust. It's called the Family Oops and Burns First Aid, and it teaches about all of those typical accidents that we see in the burns unit and the first aid advice for the families. The point is that we can learn as families. We read to children all the time as bedtime stories, and if they know and we know together, what better way to learn what to do if these accidents occur? So yeah, they're available for free. You can request for Children's Burns Trust,
Okay.
and you can have copies, and they're available in Welsh and in English
And maybe French and Spanish soon.
if you
Um,
can have anything to do with it.
I will, and I'll send out a link to that to everybody who's attended this evening so that you can get a copy of that. So, Chrissy, thank you so much. Thank you to you and to Amy for hosting, and we really, really appreciate it. And I hope everybody's taken a lot from it.
Thank you so much.
Thank you. Okay. Good night, everyone.
All right. Chrissy, you've got lots of thanks in the Q&A, so just
Oh,
so you know.
lovely. Thank you so much.
Bye.
Bye.